Hello and welcome to Plus Talk on Plus Life, where we're adapting just like you are. The whole world of social distancing, it's come down to this. Skype, Zoom, Ring Central, WhatsApp. We do what we have to because we have to stay physically apart from each other these days. Joining me right now, someone who is on the front lines, our friend Dr. Anu. Hey, Doc, what's up?
A lot. That's what's up.
I
So,
mentioned social distancing at the top there, and I really want to kind of focus on this because I think we are still not getting it, not just here in this country, but you look at news reports from all around the world. But specifically here, you see people in Florida on beaches, you still see people here on the streets of LA. Why are we not getting it?
because I don't think we're understanding what our objective is. You know, we've lost our sense personally. I think that we've lost our sense of community, being able to stop interacting to a certain degree, but also using social media for our benefit in a positive manner. So I don't think people understand the reason why we're asking for social distancing for a certain amount of time. And this is for containment. We want to contain this virus in as little of a time period as we can. Now, when we have stragglers and people that aren't adhering to this, they're the ones that potentially could be sources of infection that continue to spread this. So if everyone works together and in a few weeks we actually socially contain ourselves, we can stop the spread of this virus.
Well, and I hear that reports of New Rochelle, which I think was one of the first places in the country that was really shut down. The governor shut that down weeks ago, I think. They're now starting to flatten of the curve. For anyone who's been living on the rock and doesn't understand this whole curve, flattening, want to flatten, can you just break that down in the most simple, easy to ingest? And is that a good sign that we're seeing that flattening of the curve in New Rochelle?
Okay, I'm going to try my best to explain this. So, with this virus in particular, compared to other types of viruses that cause common colds that we're aware of, this virus, why we're so concerned about it, is because of how it affects the higher risk population. So, that's age 65 and above, or individuals that have other disorders such as heart problems, diabetes, immune deficiencies, etc.
Wait, hang on. You say immune deficiencies. I'm HIV positive. I have an immune deficiency. Am I in that group?
So I'm going to say non-compliant HIV positive individuals. What I mean by that is HIV positive individuals that aren't taking their medications on time, whose CD4 counts are low.
Okay, we're going to
Let me
circle
just
back.
clarify that.
I'll touch
Yeah,
more of that in a bit, but as you were.
right. So with this virus in particular, it's been shown that when people in this high risk group get infected, they get sick very quickly, and the slope is this high. So if we continue to socially distance and isolate, that population that we're seeing, that high risk population that can actually get very sick and die, it's almost like everything gets dumbed down or dimmed down because you're not spreading that virus to that high risk population, and it's kind of just dissipating. So you're flattening the curve.
Isn't part
Not
of the
sure if
problem,
that makes
though, that the people who are going out and are ignoring the whole social distancing thing are the ones who say, I'm not in that group. I don't have diabetes. I don't have heart problems. I'm not an old person.
And then there's a flip side to it that says the group that is completely healthy is not at high risk, and they're scared because what if I get COVID-19? And they're the ones that want to stock up. So you're seeing both sides of the spectrum, and we're losing
Well, we're
focus
all,
again on that high risk population.
yeah, and I just want to say we're also seeing, contrary to what we heard coming out of Italy, out of uh, South Korea and China, that young people are in fact getting this. And in fact, in New York, 46% of the diagnosis are people aged between 18 and whatever.
Okay, but let me just tell you that's the diagnosis. So, yes, they may have screened positive, but it's the effects of what the diagnosis does. So yes, there may be a lot more people that are COVID-19 positive that don't even exhibit symptoms, but we are trying to protect those that are at high risk that who are positive, their symptoms are insane and they're dangerous.
So, what is your message other than stay home to people? I mean, how do we get people to stop this and to really implement the social distancing?
I think that we should stop thinking about ourselves and really think about the community. Think on a broader spectrum. Even if you think that you're one person, what can you actually do? Well, let me just tell you and let me go back to how infective this virus is. For every one person that gets infected, they're spreading it to 2 or 3 people. So you do make a difference. One person can make a huge difference.
So, when we hear the president saying that he thinks by Easter we're going to be back in church and we're going to be back to business, you're a doctor, you're there on the front line, you're having some harrowing experience right there in your office on a daily basis. What do you say to that? What do you say then to people who are small business, who are in the service industry, who do work paycheck to paycheck,
I'm
who
going to
want to be
say
back
that
out
this, yeah, well, this is what I was saying is we need to talk to each other and relay to each other how important this whole idea of containment and social distancing is so that we can reach that goal that the president was talking about. Now, are we going to get there? What's going to happen to the virus? Is it going to dissipate once the summer months kick in? And the answer is we don't know.
How scary is this for you as a medical professional?
I think after seeing my sickest patient in the office, I would have to say it's scary to those that are at high risk. And that's why I'm using this opportunity to tell people that are not in that high risk group, please don't think about just yourselves. Think about another person that may end up in the hospital just because you walked outside with potentially being positive.
And it really is that simple. As I leave my apartment, I press the button on the elevator, I go about my business. Somebody else presses the button on the elevator, got the coronavirus. It really is that easy to pass on, right?
Well, again, it's passed on via respiratory droplets. So let me just make a clarification when it comes to these droplets and face masks. I'm going to use this opportunity to talk about that. So what
Oh,
they
yes, the
found out
face mask,
was,
please, because I'm seeing face masks everywhere except from the people who need them most.
right. So what they found out was the way that this virus is spread is via respiratory droplets. So it's mucus, it's saliva,
So I
things that
sneeze.
can be spread exactly through sneezing and cough, which is why we're asking people to cough into their arms. Frequently wash their hands after you sneeze. Wash your hands so you don't spread it. So it's after you sneeze or cough into your hands and someone touches that elevator button, and then somebody else touches that elevator button and adjusts their hair, smudges their eye, touches their face. This is how it's spread. So we initially were saying N95 mask, N95 mask, completely cover ourselves. Now the protective personal equipment that healthcare professionals are wearing is just a face shield. We're also wearing a gown and gloves. So we're reducing contact. If a patient is coughing, we put a face mask on them so that the droplets go onto the face mask and aren't being spread on surface. The only time that we are recommended to wear N95 masks is if these droplets are aerosolized, meaning they're broken down into small enough particles that they're floating in the air. And that happens when the patient is consecutively coughing, 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 and blowing it all into the air. Or two, if a healthcare provider or a doctor gives them a breathing treatment.
So should I be wearing my face mask to the grocery store?
I would say I would recommend wearing a face mask if, let's say, you have a slight dry cough and you have to go out, which we're not recommending, of course. But that's the thing is, if you're going and stepping out to go into your doctor's office or being checked out, then wear your face mask. Because if you're coughing onto the face mask.
So let's shift gears a little bit here. Okay, we want to stay home, but people are going stir crazy. Cabin fever is setting in. What advice do you have for us to help beat that?
This is where I would say use social media to your benefit. Connect with those through social media. We talked about Zoom, we talked about FaceTime. Use it. Check in on your neighbors, check in on your friends and family that are freaked out about what's going on. Comfort them. Talk to each other about what's going on and reassure each other or give ideas to help you through this. I think we're so used to routines that incorporate the outside world. Why not find routines within your house? Whether that be, okay, fine, waking up, taking a shower, taking your work calls, scheduling a little bit of a workout in between, cooking at home, connecting with your family and friends and having that family time, and taking this opportunity to actually get to know yourself.
Yeah, great advice. Before we wrap this up, I just want to circle back to sort of HIV and those living with HIV. Um, I know you've addressed this in earlier posts that you've done for us on Plus Life, but we hear stories about a lot of the key ingredients in HIV medicines coming from China. What happens if that runs out? Also, what advice do you have for people who are being told to stay at home, but rely on certain government programs to get their HIV meds and are now worrying about where next month is going to come from?
I would say stop worrying and just focus on the now because we don't know what's going to happen in 2 weeks or even 2 months. And at that point, that's where you have to reach out to your doctors. And we will try and figure out a pharmacy that can order more medications for you. But you need to think proactively. I'm not saying ask for a 1 year refill, but at the end of the day, if you're running out and you know that you have 2 weeks left, then ask for your refill a little bit ahead of time so you're not stuck at the end of the 2 weeks and you have only 1 day left of your medications and you're scrambling to find your meds.
I lied. This may seem like an obvious answer. Sex during the coronavirus?
I think there's plenty of that going on right now. And all I'm going to say is stay protected. But second of all, too, this comes with social isolation, but you can't say that when it comes to families, correct? Or even relationships, etc. But if one of you are sick, be responsible. Take the hygienic measures that you need to implement and social distance again and isolate yourself.
All wise words from our very wise Dr. Anu. Thank you so much